Orlando Health is Central Florida's most comprehensive healthcare delivery system, with a highly qualified team providing advanced care for 2 million residents. Dr. Jeffrey Sadowsky is the Corporate Director of Critical Care Medicine and Director of Telemedicine for Orlando Health. This video captures Dr. Sadowsky's presentation at the 8th Telehealth Innovations Forum. Seeking to enhance its regional leadership, Orlando Health instituted a plan to improve the quality and coordination of care across its delivery network. As part of this quality initiative, Orlando Health proposed expanding and improving critical care programs at 3 affiliate community hospitals.
So with doing this, we needed to have, we wanted to be NEPR compliant, so we wanted to have telemedicine coverage at our sister hospitals. Off our site, it's a 206-bed community hospital. Pretty much it was run by the pulmonologists and the hospitalists before us. They wanted to become NEPR compliant. We're NEPR compliant now. It's an 8-bed ICU, so it's a small ICU, but the average census is about 6 to 7. Our second site is a 120-bed community hospital. Again, now it's NEPR compliant. It's a 16-bed ICU, but their ICU census is also not fantastic. It's about 7 to 8. Our third site is a 171-bed community hospital. It's a 14-bed ICU. Average census is about 10 there, so that's our busy hospital. That's our last one that we brought on board. As you know, 24/7 coverage is, for lots of institutions, is cost prohibitive. There's a shortage of intensivists nationally, and there's, of course, the financial barriers. We met with the robot, I'll find the German intensivist, and we'll do sign out. Well, I'll start doing rounds with the charge nurse, the bedside nurse, and the respiratory therapist. At 9 o'clock, we start our rounds. Our schedule is 6 p.m. to 6 a.m. At 6 o'clock, we get sign out. The nurses switch over at 7. We give them about a couple of hours to see their patients and give out their medicines. And then at 9 o'clock, we usually start our rounds. With the bedside nurse, charge nurse, and the respiratory therapist, and we go through and we see every patient one at a time at each of the facilities. Usually takes about 3 hours, 3-4 hours to get through all of that. New admissions, the ER will give me a call saying, I have an admission for you. I can see what the lab work, the x-rays, the CAT scans. And say, okay, yeah, this is technically appropriate. I see admission, boom, 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 put the orders in, adds them on the phone with them. Really, the ER loves it because the patient's admitted, and then we just have to get the patient upstairs. The patient comes upstairs, and then I would see the patient with the robot. And then, we decided to, start doing the notes online, everything's online. We can get patients from the OR frequently, RRT, no problems come up on the floor. We can either bring them to the ICU immediately, or we can see them on the floor with the robot, and then if they need to come to the ICU. And then at 6 o'clock in the morning, we do the same thing opposite. We check out to the daytime physician what happened, what changes were done, what new admissions we had. And really, it's turned into a true proactive grounding model rather than a reactive grounding model. The acuity rises. We're seeing sicker patients. We're keeping sicker patients in the ICUs because we're there all the time. This is at our other facility. If you look at our average length of stay initially, it looks off the board. It looked like it was like a chronic event center. Once we started taking over both in the morning and at nighttime, the numbers plummeted. And again, we're below that. We're at this facility, we're about 4.5 our average length of stay. If you look at the DVTs, we went from 6 to 0. The VAP stayed the same. However, I can report that we have just June of 2013 was the last time we had a VAP at this facility. So we've just gone over a year without a VAP at this facility. Financially, I think it makes sense, and we've shown that it makes sense. You've got one salary for one intensivist at 3 hospitals, so instead of paying 3 intensivists at each facility.
Through its proactive TeleICU program, Orlando Health achieved the triple aim in healthcare: higher quality care, lower cost, and increased satisfaction. In summary, Orlando Health has been able to reduce patient length of stay, open up beds for throughput, increase access to specialists, improve communication with staff and families, and leverage intensivists' time. For more information on InTouch Health, please visit our website at intouchhealth.com or call us at 805-562-8686.